friends, welcome to Aware and Care, your weekly Ayurveda program with Dr. Ambika Nair, co-founder and chief consultant at Santhigram group of companies. We talk about the body and wellness and care, and of course symptomatic or a condition through herbal remedies. In this program today, let's address a very common problem, right from birth to the grave, the oral hygiene. There are situations in time where there is bad breath, and we are not sure whether it's only because of the dental problems or other issues. But to know all the answers, first we need to invite Dr. Ambika Nair. Namaskaram, Doctor.
Namaskaram.
Dr. Nair is just mentioning about a condition where we have constant bad breath despite great oral hygiene. And we have, gums, we have mouth fresheners, we have soft, we have everything. But yet there is bad breath coming. So is there an underlying condition or is it a medical term that can be used for this condition?
Yeah, it is called halitosis actually in medical term.
Mm-hmm.
Okay, otherwise bad breath. But
Bad
there
breath.
are so many underlying factors because of that. For that,
Mm-hmm.
first of all, in Ayurveda, what we say, like whether it is related with pitta, vata, or kapha.
Mm-hmm.
So we have to see the tongue diagnosis is more important in this.
Mm-hmm.
Whether it is, like whether fur coated or anything like that, how much it is, whether any marking in the tongue is there, like, circles will be formed in that. So we diagnose like that and we see whether it is due to the poor digestion strength, whether low digestive enzymes of secretion is very less, lack of oral hygiene. Sometimes, patient will have like a dry mouth. Sometimes, like what they do, they will be wearing dentures. Whether the hood is capsized over there between the dentures, even in the tongue or in the oral cavity also, intake of so much of like sour food a lot, smoking also will create all the issues, alcohol intake, even liver diseases like cirrhosis of liver, like people with ascites, all those things, and severe constipation, that all we see through the tongue actually. Then, lung diseases, asthmatic, whether any ulcerative colitis, the diseases of the intestine like ulcerative colitis or even any other things related with that, and kidney diseases, kidney failures, sinusitis. So the smell will be, like different for every disease actually, and even sinusitis, chronic sinusitis. Yeah. And like if you take a lot of garlic and onion also, that smell will be there. Whether any gum diseases, whether any pyorrhea or the teeth, like any sawdust formation, any bleeding gums, any ulcer, any other, like so many other, disorders of the tongue diseases are there. So these are all some of the things, how the bad breath will come.
Okay. So bad breath usually is a reaction from a response from other people. But in these conditions, the patient or the person themselves can also feel the breath. Or is it always that somebody has to come and tell you this bad breath?
No, normally somebody will, they move away from you.
Okay.
So that's the thing, like they will, I can understand actually, they will just move away from you. Sometimes you will not understand it, but in certain cases, they will tell that, like we get a lot of bad breath. They come and tell me also. Okay, so we see that what's the root cause and we go with that and we take care of them.
Okay. So friends, talking to people, social networking, eating your food, interactions, it's a very basic requirement of life, but the basic gets hindered because of bad breath. And we've always seen this in professional setups and also in personal relationships, that you see that people are avoiding you for a certain reason. They love you as a person, but it could be a bad breath. And it is a condition that can definitely be taken care of in today's episode of Aware and Care. We're talking about bad breath. So Dr. Nair, we just mentioned that, sometimes people can themselves also feel the bad breath. Now, we talked about so many underlying conditions. So how do we go about treating these conditions? Where does the Santhigram start testing the person? Is it because of body type?
Tongue diagnosis.
Just tongue diagnosis.
And pulse diagnosis.
Okay.
So there it starts. Why are they getting the problem? Then you go with the root cause.
That is there. So what about kidney disease? Do some people with kidney disease also have
kidney diseases? Because they will have so many other complications, then for this we help them a lot.
Okay.
Yeah.
So now let's start about by somebody who has halitosis. So they overbrush themselves, or they scrape their tongue more often, or they use lot of mouth freshness. that could not be the remedy. It could only be a temporary solution. Thought
It's
about
a
it.
very interesting. That's what I was smiling. People
Uh-huh.
come, oh, I never knew even these simple things will help us.
Okay.
Okay, because when we tell, the remedies,
Uh-huh.
like normally we do the Gendusha, that is actually called the oil pulling.
Mm-hmm.
Okay, so, we have like Ayurveda, the mouthwash.
Mm-hmm.
Even for sinusitis, it helps a lot, even the mouth dryness and all those things. So like a tongue diagnosis, I told you we do that. Okay, so constipation or anything like that, so some herbs also will be given. If Panchakarma is needed, we will go with that. You
Okay.
understand?
Mm-hmm.
So according to the problem of the person.
Mm-hmm.
Okay, for everything, just for a small, issues, nobody will be doing Panchakarma. But if
Mm-hmm.
it is severe and if underlying causes are more, then we advise for the Panchakarma.
So
Okay.
I'm a little confused here, Dr. Nair. See, when we spoke about what could be the underlying conditions, basic is oral hygiene. That everybody comes when we visit a doctor or a dentist, we are always brushing our teeth and then going to them. Now, when you see a patient and you do a tongue diagnosis and you realize that the patient's condition is because of an underlying condition, you reach that condition first and then automatically this
Yeah, then automatically this will be taken care. That's why when you treat for the root cause, the things will be settled.
Mm-hmm.
And diet is also important at that time. And
Mm-hmm.
what they have to do, how they have to do their oral hygiene.
Mm-hmm.
Getting up in the morning and brushing your teeth. And not only, doing the oil pulling,
Mm-hmm.
what oil with what they have to do, whether they have any mouth ulcer, then
Wow.
what they should use. Normally, like in the routine, what they should do.
Uh-huh.
All those things we will be telling them.
And very interesting point that you mentioned, which I did not think about when I was talking to you, is about dentures. And I think this is usually young age. And today, of course, adults also are using dentures or braces for that matter.
Braces, actually, so many children, they suffer and they feel so shy to talk.
Mm-hmm.
Yeah, because it get capsized over there,
Mm-hmm.
deposited over there.
Yeah, and at a very young age, using braces and going through bad breath, it gets a big hit to the self-esteem of the teenager or a young child also. So we'll also talk about that, how to take care of that. So apart from this, what about the nasal drips or sinuses or headaches?
No, sinuses, then we do the Panchakarma, like Nasyam will be done for them.
Mm-hmm.
And the diet will be given, because that will be like, like a kapha related.
Mm-hmm.
So, we tell them to use ginger and honey, especially mixed with, warm water, do the gargling with that actually. So it reduces the kapha also. So, and turmeric and ginger, little bit of even ginger powder, like a pinch of ginger powder, and 1 teaspoon of honey and warm water.
Okay.
It's very nice. So when they do it, naturally it will take care of your mouth, actually oral hygiene.
Okay.
Then, you can help, like a cardamom,
Mm-hmm.
1 piece of cardamom, little pinch of cumin seeds, and fennel seeds. You can boil it and you can do the mouthwash every day. So that all really works. So see, this all will be done, when you don't have any, just only bad breath, you don't have any other underlying diseases.
Yes. Okay.
Yeah, that is more important actually, because people will come and ask us.
See, because in our previous episodes, we've also done tonsillitis, we've also done mouth ulcers. In those conditions, of course, the remedy and the process of reaching that is because the medication itself is starting from the mouth. So the treatment procedure could be a little varied, but it is definitely curable. But if there's an underlying condition, that's what we're talking about, which is reasoning out to bad breath. There could also be those little inside the tonsils, people have certain secretions which create a lot of bad breath. So we talk about that. What kind of body types, compositions, or doshas actually ignite bad breath? Is there certain
So
types?
if underlying diseases are there, it will be, any dosha can be, but mostly we have seen in indigestion and the kapha.
Mm-hmm.
And, and oral hygiene is not there. That is also there.
Okay.
Yeah.
Oral hygiene seems to
After, yeah, morning and evening, we are supposed to brush the teeth. Some people are a little lazy.
Mm-hmm.
So they will think that, just rinsing with anything, it will work. But some cases, it will not work.
So you mentioned about oil pulling. So I have seen that in the last couple of episodes also people have asked, oil pulling is required once a day or once a week or twice a day. How do
No. You can do twice a day if you have like a problem is severe. Otherwise, you can do it, once a day. Once a day, it will take care.
Okay. Now
Yeah.
today in bad breath, we'll come to finally to Santhigram. And of course, the treatment has already started with so many home remedies that you're mentioning. Let's go through a patient's treatment process. How many days or what kind of dietary changes that you recommend and how does it work apart from the underlying conditions they have?
Diet, everything, like, see, now everybody uses the brushing only.
Mm-hmm.
So, what Ayurveda, like it recommends for the tongue cleaning, like so that your halitosis will be taken care. Scrape the tongue from back to the front. That is the best way. Okay, so you can do it by using first 2 fingers. Also, no need for the anything else. Even with your own fingers, you can do it.
Mm-hmm.
Okay, and use them in metallic scrapers are also being used.
Mm-hmm.
There is nothing, like people will ask, can I use silver, gold, or anything like that? There is nothing in that actually.
Mm-hmm.
Now, in Kerala and all, we used to do with the coconut that from the tree, what we take.
The husk of the coconut.
Yeah, that will we used to do, but now it's not like that.
Yes.
Yeah. So, like, you see, in this condition, like the Panchakarma treatment can be for 1 week, some days 2 weeks, sometimes 3 weeks, because according to the disease, we go with the Panchakarma.
Mm-hmm.
How many days they need.
Okay. So this bad breath, can it be transmitted to somebody or is it only leading to headaches?
No, like it can be a headache, will be there, they will move away, so they will not get any issues. Don't worry.
Okay. No, but for the patient themselves also with bad breath, they
Will
must be
sit like this. Now mask is there, so that's a blessing in disguise. Otherwise, they will sincerely telling, that they will come, like when we come near, show me the tongue, they will tell, oh, no, it is a bad breath. No problem. That's okay. Okay. Because so they came for help.
Okay.
So we cannot show that, like face to them.
Now, let's also understand people who have really severe oral hygiene disease, diseases like gum disease or oral cancer or throat cancer. When they are facing bad breath or their hygiene situation is very difficult to take care, how does Ayurveda help patients like that?
Yeah, we give them Khadiradi Vadiga, like, and even St. Madhu. Tablets are also there. Like, why see, that's what I'm telling, like metabolism has to be come back. Their digestion has to be taken care. That's what herbal products are also, like we give them a lot. And so much, see, not only you are telling about the oral hygiene, and their flatus also will be very bad smelling.
Okay.
So, like then we like we know, and there some people will have order from there, if their uric acid is on the higher side and all those things there, like a smell also will be there. And we'll ask them how the urination, whether frothy, everything like that. Even like so many conditions are there, like, yeah.
Dr. Nair just mentioned about the odor. So do I have to understand that there is a possibility for some extreme cases where the
extreme cases comes. So many cases.
Is very high at that point?
Yeah, no, it all depends upon, I'm telling how the patients comes and how we see. And even like ascites and cirrhosis of liver, they have a very bad odor actually. Sticky saliva, dry mouth. You understand? No? So when they come, we know that how they cannot take it out actually, very sticky. Even though they drink water and all. Hydration, like it. And foul, like some people will have very foul smelling gas formation also.
So friends, in this program today, we're talking about halitosis and the problem and the condition and the symptoms all are being dealt with. Yes, you must be wondering that why aren't we talking about the solutions? We want to cover all aspects to let you know that this program is only because we want to let you know that there is remedies available, there is support available, there is medical medicines available, and you don't have to feel embarrassed and shut down yourself before approaching a family member or a doctor to talk about it. And doctor has seen thousands of cases such where, patients have come with bad breath, and in her profession, the first thing she does is show me your tongue, the pulse update. So of course she is aware. So Dr. Nair, we're talking about the oral hygiene and other aspects. Now, can we have a home remedies or solutions to avoid this for patients who just have basic bad breath?
Yeah, indigestion. So
Indigestion.
if it is indigestion, we ask them, home remedies, like they can have like a little bit of what they call dry ginger powder, mix it with a little bit of ghee, like a half teaspoon of ghee, and consume just 10 minutes before your food. So if your digestion, because I stress on that point. So tomorrow they should not tell that you told I had a mouth ulcer, all these things happen, nothing like that. Okay?
Yes.
So it is very useful for digestive and very good carbonation, so that carbonative also, so that your gas formation will not be there much, it will go away. And there are so many other Trikadu Churna, people are aware of that. Even Triphala Churna is there, Levana Bhaskar is there. So many things are there, and even you asked about the Panchakarma treatments also. So here we cannot do the, like Vamanam, Virejana, we will do it. Nasya treatment, Basti treatment, like how to throw out the ama from the body. That is what we do it. So once the toxins are out, they will feel very good and their digestion will be good. Then how to manage it, we tell them actually.
Okay. So, Mr. Doctor, now we have different age groups of people with mouth, odor, bad breath coming. For children and up to teenagers, there is parents who can help them with introducing these kind of foods. And like you talk about, I think it's Sonti, right? Ginger powder that you eat first. And traditionally also it was recommended. Now, as we progress, we have a lot of traveling to do, a lot of, irregular eating habits and foods that are not cooked at home and outside you're picking up. So how does somebody make it a point to include certain foods when they're eating outside?
Chewing mint. Mint leaves are very good. Basil leaves are very good. Now you get like, fennel seeds are there. Little bit of cardamom, you keep it. One clove in your pocket. That also will take, at least it will mask the temporary, smell. Okay. And drinking water, like a lukewarm water has to be drunk. Not like a very cold food, that should not be avoided. That should be avoided actually. See, you should not be dehydrated. So your dry mouth will be taken care, and certain foods are also, avoidable foods, that I will tell. Smoking, alcohol consumption, people will hit me when I tell like that. Avoid, like a brushing, toothbrush having, like a high, like they don't change the toothbrush with the high bristles, so that I injure the gums around. Okay, sour food, like very sour curd, if you are using it. Okay, keeping it outside for a long time. Non-vegetarian food. Okay, after non-vegetarian, you have to really brush your teeth actually. So much of jaggery, black grams, excess of milk, everything, like like everything is in little quantity is fine. But here people, like when you overdo the things, only things will, sleeping in abdomen, the digestion also will hinder. Daytime sleep. But, people ask me, if we do the night duty, how you can tell us not to sleep in the daytime? So that all, it
that
is all.
Treatment's sake, because of course body needs
Yeah.
rest. They can take time it is, but basic precautions and remedies Dr. Nair is just prescribing here. And I think the best diagnosis is always to meet the doctor first. Now, doctor, somebody with bad breath, of course, because of being so conscious, they're doing too much of oral hygiene, too much of brushing, too much of rinsing, too much of gargling. Can that damage and harm it further?
Definitely. Yeah, gums will get, and even diseases can happen, We have to take precautions only. And halitosis, bad breath is not, that is only a sign and symptom of, like the underlying diseases actually. It may not be a disease sometimes, little care, like it is the body is expressing you. You have a disorder, underlying disorder. But people doesn't understand, not only the proper care of teeth and gums, tongue with the dietary things and, like if you really take care of little bit of your body, this halitosis can be taken care. Bad breath will not be there. People will tell no need for that. We can use mouth fresheners and all those things.
So friends, like Dr. Nair just mentioned, the body is crying for help. So do not feel embarrassed when you have a bad breath. Deal with the condition. And of course, this is not a life-threatening condition where you have to shut yourself completely and feel completely awkward about it. It is a temporary condition. It could be treated. And if there is bad breath and it's having on a chronic basis, the first is to meet your doctor to find the underlying causes. It could just be because of bad oral hygiene, or it could be for an underlying health condition, and you must be sometimes thanking your bad breath also. Right? Am I right, Dr. Nair?
Absolutely.
Okay. So any other points that you want to mention to our viewers at this point about oral hygiene, or any other foods that they should avoid when they have bad breath?
The digestion has to be taken care, that's all. So they will tell, bloated abdomen, bad breath. Sometimes it can be because of the low backache or anything, some urinary tract infections, using up so much of antibiotics if it is not digesting in the proper way, assimilation, like the small things, if you take care, this can be really taken care, and people will love you.
Absolutely. Thank you so much, Dr. Nair, for this episode about bad breath halitosis, and it is a curable condition. And if you have one, do not feel embarrassed. Doctors have seen thousands of cases, whether it's Dr. Nair or any other doctor. They know that bad breath is a symptom at many cases, and sometimes it's just a small condition which can be treated.
Yeah. If you don't have any other oil at home also, no, you may have some cast, like any oil, whatever, like even gingerly oil, mustard oil, or anything that you can use it for oil pulling. Even people use, coconut oil, they come under. So whatever you do, and when the things will not move in the right way only, please see the doctor so that you don't suffer more.
Absolutely. Thank you so
Thank
much.
you so much.
Friends, like, share, and subscribe to the channel. Any new episode which comes up, it will give you an indication so that you don't miss out on that, and not panic about your health conditions. And if there's something, a very awkward condition or very important condition which you're not able to talk to, you can always feel free to message us. We will bring that topic up in the next episode. Until the next episode, take care. Thank you so much, Dr. Nair.
Thank you.